Welcome back to the NEI Podcast. In this special re-release episode from June 2022, we revisit our enlightening conversation with Dr. Sarah Vinson, a distinguished expert in psychiatry. Dr. Vinson shares her profound insights on breaking down structural racism and enhancing Black mental health. Her unique perspective, drawn from her extensive experience in adult, child, adolescent, and forensic psychiatry, offers invaluable knowledge on these critical issues. Join us as we delve into this crucial dialogue once again.
I'm Dr. Sabrina Siegel with the Neuroscience Education Institute. Welcome to the NEI Podcast. On this show, I sit down with renowned mental health care experts from a range of diverse backgrounds to discuss breakthroughs and best practices for treating patients with mental health conditions. In this episode of the NEI Podcast, I have here with me today Dr. Sarah Vinson. I am so excited for her to join us on this episode, and we are talking about breaking down structural racism and improving Black mental health. Welcome, Dr. Vinson.
Thank you so much for having me. Glad to join you.
Dr. Vinson, my first question for you is, what exactly led you to pursue a career in mental health?
For me, it was one of those things that I tell people, it chose me. When I first went to medical school, that was not the plan. I did not see that coming. I thought I was going to be a pediatrician.
Okay.
And with med school, the cool thing about it is they expose you to everything, right? So people like me that thought they were on one path, they get to see what these other things they didn't think they were interested in feel and look like. And in doing so, sometimes you identify things that you didn't have on your radar before. And what I found with mental health is that it was this field that wasn't talked about as much, sometimes wasn't given as much respect, especially in medical circles. But when you looked at the impact on people and on their lives and on the lives of everyone in their circle, it was this huge deal. And it was so interesting because it brought in elements of culture and religion and meaning and identity that you don't get to explore in other aspects of medicine in the same way. So once I saw it, I couldn't unsee it. And it was very clear this is what I was supposed to do, but it snuck up on me.
Wow, that is so powerful and such an inspirational perspective. I love that. What are some disparities in mental health care when it comes to Black mental health, especially in this country?
Yeah, and what I'll do or what I'll start with is that I think language is always really helpful and important. And one of the things that is a soapbox of sorts for me, and I'll credit my collaborator, Dr. Ruth Shim, with this. A lot of times we say disparities when we are really talking about inequities. And the difference is that with inequities, you are explicitly acknowledging that it's not just some difference that popped up, but this difference is the result of choices that we've made in our society about who gets resources and who gets opportunity and the uneven distribution of those resources. And that it really isn't just that Black people happen to have different outcomes. Systems are set up in a way that produce those outcomes quite reliably and consistently and have throughout the nation's existence. So I'll start there. And then what I'll say is that when we look at mental health care or when we look at mental health diagnoses or mental health symptoms, we know that trauma is something that is going to increase the risk of people having symptoms or diagnoses. And we know that the Black population in the United States has always been subjected to myriad traumas, the same ones that society is as a whole, but ones that occur as a result of being Black and things that you're at higher risk for experiencing as a result of being Black. So there are all kinds of statistics and data and those sorts of things. But I think the bigger thing to understand is that whenever you have a group that is marginalized, not protected, victims of violence at disproportionate rates, that of course is going to affect how you think, feel, and behave, which are the core of mental health disorders.
Yeah, absolutely. Well, I understand that you are triple board certified in adult, child, and adolescent and forensic psychiatry. First of all, I just have to say that's absolutely amazing.
Thanks.
Why did you become interested in child psychiatry, forensics, and the intersection between the two?
So like I said earlier, I thought I was going to be a pediatrician, and it's interesting at a certain point in life, and I just turned 40. So I tell people like I'm officially middle-aged now, but like you think back, and I didn't think I would be a psychiatrist, but I was interested in law, in pediatrics, in journalism, in history, right? Like that was kind of my list if you'd asked me in high school. And I'm not technically doing any of those things. But what I do now actually incorporates elements of all of that, right? So we're thinking about justice. We're thinking about children and advocacy. We're thinking about how what's presented to you in this moment is representative of the larger narrative and context. And forensic psychiatry is actually, contrary to what you see on Law and Order and things like that, it's a lot of writing because a lot of things don't go to trial. And so my job in a lot of ways is to take what I understand about society and these isms and these inequities and take what I know about mental health and healthy development and children and write and create a narrative that the court can use to try to have decisions that look more like justice.
Wow. That's so inspirational. I just love it. Can you explain why it can be challenging to fight structural racism, especially when it comes to mental health care, law, corporations, and organizations?
Man, and I think the answer is embedded in the name, right? Like it's built in. And so it's not a matter of identifying or shaming or canceling like a single bad actor, right? It's about how the system has been set up and how that setup favors one group or another. And, you know, it's been interesting having conversations these past few years with people who are setting up like diversion programs and thinking about how you do this in a way that decriminalizes mental illness. And one of the things that comes up quite a bit is that there's not explicit anti-racism as part of that revision process.
Right.
One of the things that I say repeatedly is you have a racist system. If you have a race-blind revision to a racist system, you're going to have racist system 2.0. And there are things that people don't think about as being racialized, right? Like it doesn't say black or white. But if you're talking about things like arrest record, particularly for things like marijuana possession, that is a racialized metric.
Right.
Because we know people use it at about the same rates. We know people aren't arrested at the same rate. So there are things that can, to the untrained, uninformed eye, reliably create racial inequity that are part of how systems operate that we really have to be intentional about rooting out, changing, and then after we do that rooting out and changing, actually measuring to see if it had the desired or the intended effect.
Right. That's such great information. Thank you for sharing that. How has your work in psychiatry consulting and education made a difference in fighting racism on both the individual and structural level? What can you share with us?
Yeah, and it's one of those things where the analogy of turning around a cruise ship, right? Like this is entrenched. This is centuries long. My book came out 2 years ago. Like
I know
we're working, but I will say I do have things that I'm encouraged by, and part of it is just the way that the conversation is shifting. Part of it is the way that this newer generation of mental health care providers is thinking about, talking about, engaging with these topics in a way that, quite frankly, most of the people who taught me never did. And what we're seeing is that even if we don't know how to fix it all or turn it all around, at least we're starting to see it. We're starting to acknowledge it. We're starting to use language to describe what's happening that gives us a starting point. And one of the things I say too is that, you know, having me come talk or do grand rounds is not the work. Like the actual work is changing the way you operate and measuring it and seeing if it's more equitable. But you can't get to that if you don't first see that there's a problem and also understand that it's a problem you have a hand in creating and that you can have a hand in fixing.
Changing. Yeah. Wow. Yeah, it does. It seems daunting. And yet it seems like by taking small steps and actionable steps, people can make a difference. And yeah, I do think that it all begins with awareness. So that education is an excellent start. Can you tell us about being the founder and executive editor of the culturally tailored psychoeducational website? Speaking about education, the website is called OurselvesBlack.com. What inspired you to create it, and what is the mission behind it?
So for me, it's great that there are doctors and people that go to graduate school and get master's degrees in mental health. But the reality is a lot of people who could benefit from those services or who could benefit from that information aren't going to necessarily make their way into a therapist's office.
Right.
I think that it's really important that if we're talking about mental health professionals actually impacting the mental health on a population level in a significant way, some of that work has to be outside of clinic. It has to be out of the mental health care structure that for so many people just isn't readily accessible. And so that project really came out of my desire to start dialogues and think about how these issues impacted our community and to broaden the discussion around it, because sometimes it can fall into this, well, I'm not crazy. And that's the end of it. And it's like, well, there's a whole continuum, and this issue of mental health has relevance to you, whether you've ever had a diagnosis or qualified for a diagnosis or not. And really sort of combating that narrative that it's either or, and really helping people understand there's always opportunity to think about your mental well-being and to think about that in the context of the realities of the society that you're in. And also not just thinking about the trauma piece, but when you're talking about the Black community, thinking about the resilience piece as well, and the intergenerational resilience that has had to be shown in order to survive and continue to be such significant contributors to American society.
Oh, yeah.
And so that's what that was about.
Wow, that's great. Thank you for sharing that with us. And now I know you said this book came out a long time ago, but what is your book, Social Injustice and Mental Health, about?
So part of the backstory with that book is that we originally went to the publisher, and it's published by APA Publishing, and we pitched Social Justice and Mental Health as a book title.
Right. I see that.
Yeah. And we found, as we were going through all the information, as we were reviewing and revising the chapters in collaboration with our wonderful chapter authors, that the story wasn't one about justice. Like, there was actually really very little justice that we saw. There was much more injustice. So we actually went back to the publisher about changing the name.
Wow.
And so ultimately, what the book captures is the way that societal structures and their failings, or maybe their design that differentially fails some people, maybe a better way to put it, actually leads to circumstances that manifest as things that we call symptoms and that we call illness and that we respond to in these different ways. But things that are really occurring in response to decision, things happening at really broad levels. And as two psychiatrists who see patients, one-on-one and find value in our work and love what we do, I think the takeaway was that as long as this is how we're set up and this is how we're treating people and these are the decisions we're making, we're never going to have enough psychiatrists or psychiatric medication.
Right. Wow. That's profound. What has your experience been like in your position as psychiatric advisor to the Judges and Psychiatrists Leadership Initiative?
Yeah, so this is a really rewarding group to be a part of. I get to work with judges and lawyers and staff at the American Psychiatric Association. And we think about how we can be part of that education work on the legal side, and how we do that in a way that is relevant and accessible to people who aren't mental health professionals, but who are making decisions about people with mental health conditions every day from the bench. And for a lot of those people who face those barriers to accessing the mental health care system that I alluded to earlier, the de facto system, and the one that always has its doors open, so to speak, is the criminal justice system.
Right.
And so again, just thinking about using what was a mental health professional to affect change. If such a large proportion of people aren't making it into the mental health care system, the question is, okay, which system are they in? And how do you become part of or be a resource to that system in order to help them better serve those individuals?
Right. I think it's so needed, that type of position, because as you said, when people are in the role of setting policies or making those decisions, but they don't necessarily have a specialization in mental health, it's so needed to have a position like one that you're in for that. So I think that's excellent, and especially in terms of change. What is unique about Lorio Forensics, and why did you create this consultation company?
So in my mind, like, all of my work is really about equity and leveraging my privilege to try to get closer to it in whatever space I'm in. And as a forensic mental health consultant, something that is very clear is that the problems we have with diversity and representation in mental health care are even more pronounced with forensic experts. And that's a problem on its face. But when you think about what the stakes are, it can literally be life or death.
Yeah.
It can be if someone gets to maintain custody of their child. It can be if a mandatory minimum is given to a 17-year-old child, right? And so the fact that we have these representation problems is tremendous. And it's a field where it's very relationship driven. It's very word of mouth driven. So it can be harder to kind of break in into it. And so to be a Black woman who thinks the way that I do and is trained the way that I am to have my foot in the door, I kind of reached a branch point where it was like, either I take all of these cases for myself and kind of give up these other things that are really meaningful to me, which I didn't want to do, or I say I can't do it and know that there are options for having a culturally and structurally informed forensic mental health professional other than me are quite limited. So they may end up with someone who doesn't have it.
Right.
And the third option was, well, I just build it.
Yeah.
Because the traditional way has produced what we have now. So it's not going to create it. I've seen what it's capable of creating. And so the company is really about giving more people involved with the system the opportunity to have evaluators who think in this way, and also giving evaluators who are absolutely capable of doing the work, but who don't go to the country club that the judges happen to hang out with. Right? The opportunity to do the work. And what we found is that they're doing fantastic work. We're getting repeat people hire us. We've grown a lot. So it's working. It's really
incredible. That's so good. That's so great to hear. That's wonderful. Okay, so that actually takes me to my final question for you, which is, what advice do you have for mental health providers who want to make a difference and fight against structural racism? How can they become better educated in cultural humility? That seems to be a theme in a lot of educational approaches. And I'm just wondering your thoughts on that. How can someone get more involved and start to make a difference if they're not really sure what to do?
Absolutely. And that's a great question. And I think sometimes when issues are so big, so entrenched, so complicated, that you can throw your hands up and say, what can I really meaningfully do here? And the answer is a lot. It comes down to looking at your privilege, your position, your skill set, and thinking about how you can leverage it. And it doesn't have to be writing a book or starting a firm. It can be, how can I intentionally mentor and sponsor people who are from groups that are historically marginalized and not given resources, right? It can be something as simple as deciding that as a matter of practice, if you're invited to write a book chapter or submit an abstract to speak at a conference, that you are going to be intentional about involving people in that project and using it as an opportunity to help advance someone's career who may not have anybody in their family who's doing this kind of work, who can sort of mentor and guide them along the process. So I think for people who are mental health professionals, that most of them want to help, and that's why they went into the field in the first place. And I think part of the challenge is understanding that this work is not peripheral or extraneous or anything like that. If we're talking about really shaping population mental health, this is core to the mission. And once you understand that and start thinking about your place and your privilege, the opportunities to do it are there. They're always going to be there. It's just a matter of staying open and in being committed to taking advantage of them.
Wow. I love your perspective. And I mean, just this interview alone has been so eye-opening and has just been such great information that you've shared with us. So I really thank you so much for all of this, and thank you for being on our show.
Thank you so much for having me.
Thank you so much for joining us for another episode of the NEI podcast. Please let us know what you'd like to hear more about by leaving a review. Don't miss another episode. Subscribe today.